Yeah, come on.
Good to see you again.
We need an insurance executive. Good morning, everyone, and welcome. We are glad to see you here, and I know we have various members of the legislature and others that have joined us. I want to thank this group of business and industry and other leaders from across the state who have joined us this morning for what I think is a very important announcement. Before I start, let me take you back a little bit to June of 2012. The United States Supreme Court decided that the federal governments could not mandate states to expand their Medicaid programs. That was an unexpected decision across the country. And in Tennessee, we decided to take the time to evaluate our options and decide what was best for our state. In March of 2013, up in the House chamber, I announced that Tennessee would not expand our Medicaid program. Expanding a system that, in the president's own words, was broken, I didn't think made sense then, and nor do I think it makes sense now. But I also didn't think that flat out saying no to accepting federal dollars that Tennesseans were paying for, that were going to other states, and that could cover more Tennesseans in need of health care coverage made sense either. So we started the work to find a third way for Tennessee, a Tennessee plan. A plan that would leverage those federal dollars to really begin the work of fixing what is wrong with our health care system, to better align incentives for providers and consumers. Regardless of where you are on the political spectrum, I think you can agree that we're not going to contain costs in our health care system until incentives are better aligned than they are now. We saw the opportunity to bring providers to the table to improve the way we pay for care, to move from fee-for-service, volume-driven structure to an outcomes, value-based approach to how health care is paid for in our state. As we saw an opportunity for more Tennesseans to be covered in a way that also made them active participants in their health and rewarded their healthy choices. I'm here today to announce a plan to do just that. It's called Insure Tennessee, and we reached final agreement with HHS just this last Friday. After 17 months of hard work, we will be presenting a plan to the General Assembly next year that addresses health outcomes and costs. It's an alternative approach that forges a different path and is a unique Tennessee solution. Here's how it will work. Insure Tennessee is a 2-year pilot program that will not create any new taxes for Tennesseans and will not add any state costs to the budget. The Tennessee Hospital Association is committed that the industry will cover any additional costs to the state. The program will automatically terminate in the event that either federal funding or support from the hospitals changes in any way. What this means is that Tennesseans who are 21 to 64 years old, currently not covered, and earn up to $16,100 a year, that's 138% of the federal poverty level, they will have 2 new options for health care coverage. The first is called the Volunteer Plan. It would provide a health insurance voucher to participants that they could use to participate in their employer's health insurance plan. It's our belief that over half of the folks who would be covered by this plan are currently working. They just can't afford to be in their employer's health insurance plan. This voucher could be used to pay for premiums and other out-of-pocket expenses that are associated with private market insurance plans. The second is called the Healthy Incentives Plan. Participants in that plan could choose to receive coverage through a redesigned program of TennCare, which would introduce healthy incentives for Tennesseans, or HIT accounts, modeled after health reimbursement accounts, which can be used to pay for a portion of required member cost sharing. Insure Tennessee introduces personal responsibility and patient engagement through choice, incentives, and copays. Members will have the ability to be reimbursed for out-of-pocket expenses through making healthy choices like preventive screenings. You know, I'm excited to be here today announcing this. As you all know, we've been working on this for a long time, and a lot of folks on both sides never thought that we would come to an agreement. But there is a lot of work ahead to make Insure Tennessee a reality. We've received verbal approval from the Department of Health and Human Services. I look forward to working with the people here today and all across this state that understand what this plan can mean for hundreds of thousands of Tennesseans. I look forward to working with members of the 109th General Assembly. After they reconvene in January, I plan to call a special session for them to consider this plan. I believe something this important to so many Tennesseans should have a full discussion and its own focus. We will also submit our plan to the federal government in the form of a waiver, which is what has to happen when a state proposes to do something different. Sorry about all the feedback. Let me just conclude this way. Some might ask, why is a conservative Republican up announcing that we are going to do this? In all of the discussion that we're having about health care across the country, no one has ever argued that we are going to end Medicaid. At least I don't think people are out there arguing that. There's discussions about the Affordable Care Act, but the discussion about whether Medicaid should go away has not been on the table, and I don't think should be on the table. Medicaid was created to provide a safety net for our most vulnerable citizens. The discussion has always been, how do we do that in a responsible way, responsible to the users of the service and responsible to the budgets that are impacted. It's our hope that Insure Tennessee plan opens the door in the future for innovation within our existing Medicaid program. We want to incentivize and support Tennesseans to be a part of the solution. Too many of our health care costs in Tennessee and across the country are based on poor health habits and choices. To me, it's never been a question of should we provide compassionate care for people, but more a question of how do we do that in an effective way. I truly believe that the Insure Tennessee plan can be a catalyst to fundamentally changing health care in Tennessee. Again, I want to thank those folks that have joined me here today. We have a lot of discussion to come, and that's a good thing. This is a serious issue that is being dealt with in different ways across the state. We think we have a plan in Tennessee that fits our citizens and also is an answer to budget challenges that we would face in the future.